If I were in charge during a possible hantavirus outbreak on a cruise ship, I would probably not allow immediate docking until health authorities could properly assess the risk and complete quarantine and screening procedures. That's not because I'd want to abandon passengers, it's because containment is a standard public health measure when officials are still determining the extent of exposure and possible transmission. I understand that the passengers have friends and families who love them, but it is not safe nor fair to risk 8 billion other people's lives. At the same time, I also think governments have a humanitarian responsibility to support people during quarantine. I'd want supplies, food, medicine, and medical personnel delivered through controlled methods such as helicopters, drones, or isolated port operations while experts evaluated the situation. One thing that's important to understand is that hantavirus is not one single disease with one single fatality rate. Different strains behave very differently. For example, Andes virus, approximately 25 to 40% fatality rate. Sinombre virus, around 30 to 40%. Hantan virus, roughly 5 to 15%. Sol virus, closer to 1 to 2%. Puumala virus, often below 1%. Most hantaviruses primarily spread through contact with infected rodent droppings, urine, or saliva, not normal casual interaction between people. However, the Andes virus is notable because rare person to person transmission has been documented, particularly through close contact. I think situations like this show how governments have to balance scientific caution, public safety, and humanitarian responsibility at the same time.